Patient with CPOD, present with severe breathlessness, respiratory rate 32 and saturation 85% on room A. What is the first nursing action? Start CPR, give high flow oxygen that is 10 to 12 liters per minute, give controlled oxygen that is 1 to 2 liters per minute via nasal cannula, give salbutamol nebulization immediately. The correct answer is option C. Give controlled oxygen 1 to 2 liters per minute via nasal cannula. COPD patients need controlled low flow oxygen that is 1 to 2 liters per minute to avoid carbon dioxide retention. After stabilizing oxygen, bronchodilators can be given. A post-operative patient complains of sudden chest pain and difficulty breathing. What should the nurse assess first? Option A, urine output. Option B, saturation level. Option C, abdominal girth. Option D, bowel sounds. The correct answer is option B, saturation level. Sudden chest pain plus dyspnea may indicate pulmonary embolism. Oxygen saturation must be checked immediately to assess severity. A diabetic patient with foot ulcer has foul smell, redness, and fever. What is the priority action? The correct option A. Apply warm compress, document the findings, start antibiotic as prescribed, teach foot care. The correct answer is option C. Start antibiotic as prescribed. Signs indicate infection. Treating infection, antibiotics is priority before other intervention. A patient on digoxin reports nausea and visual disturbance. What should the nurse do first? Check apical pulse for 1 minute. Hold the next dose and inform doctor. Give antiemetic, increase fluid intake. The correct answer is option B. Hold the next dose and inform doctor. Nausea plus visual halos indicate digoxin toxicity. The dose must be withheld and doctor informed immediately. A patient receiving blood transfusion develop fever and chills within 10 minutes. What is the nurse's first step? Option A, slow the infusion, check hemoglobin, stop the transfusion immediately, give acetaminophen. The correct answer is option C, stop the transfusion immediately. Fever, blood chills early in transfusion is considered as acute hemolytic reaction. The transfusion must be stopped immediately to prevent complication. A patient with diabetic ketoacidosis has potassium level 3.0 milliequivalent per liter. What is the priority? Give insulin as prescribed, administer potassium replacement, give IV fluids only, give sodium bicarbonate. The correct answer is option B, administer potassium replacement. Potassium is low. Giving insulin will further decreases potassium and can cause arrhythmias. So correct potassium first. A patient is unconscious after a head injury. Which position is correct? Supine with legs elevated, prone position, side lying with a headline midline, tunnel bug. The correct answer is option C, side lying with a head midline. Side lying prevents aspiration, head midline promotes venous drainage and reduces intracranial pressure. A patient with heart failure has crackles, edema, and weight gain. Which nursing action is most important? Encourage high fluid intake, monitor daily weight, administer diuretic as prescribed, provide ambulation support. The correct answer is option C, administer diuretics as prescribed. Fluid overload signs needed diuretics are priority to prevent pulmonary edema. A patient with severe burns develop decreased urine output. What does this indicate? Adequate hydration, renal failure, hypovolemia, increased perfusion. The correct answer is option C, hypovolemia. Burn patients lose plasma into tissues, leads to hypovolemia, which reduces urine output. A patient with cirrhosis has ascites and confusion. Which lab value is most important to check? Sodium, potassium, ammonia levels, calcium. The correct answer is option C, ammonia levels. Confusion plus cirrhosis are symptoms of hepatic encephalopathy that increases ammonia. A patient with pneumonia has respiratory rate 34 breaths per minute, use of accessory muscles and saturation 88%. What is the priority action? Start IV antibiotics, give oxygen therapy, encourage coughing, check temperature. The correct answer is option B. Give oxygen therapy. Severe respiratory distress. Needs oxygen. This oxygen is the immediate priority before other treatment. A patient with chronic kidney disease presents with itching, fatigue, and yellowish skin. Which lab finding is expected? High calcium, low potassium, high creatine, low phosphate. The correct answer is option C. CKD decreases filtration that rises creatine, causing uremic symptoms like itching. A patient on IV fluid develops sudden swelling and pain at the IV site. What should the nurse suspect? Infection, infiltration, phlebitis, air embolism. The correct answer is option B, infiltration. Swelling plus cool screen. The correct answer is option B, infiltration. A patient with acute asthma attack is unable to complete a sentence. What is the first step? The correct answer is option B. Give bronchodilators nebulization. Severe asthma needs immediate bronchodilator to open airways. A patient receiving morphine shows respiratory rate 7 breaths per minute. What is the first nursing action? Increase IV fluids, give naloxone, call the doctor, apply oxygen mask. The correct answer is option B, give naloxone. Respiratory rate less than 8 breaths per minute means respiratory depression from morphine. So naloxone is antidote. A patient with myocardial infarction, complaints of chest pain radiating to left arm. What is the first intervention? Give aspirin, take ECG, start CPR, provide reassurance. The correct answer is option A, give aspirin. In chest pain suspected myocardial infarction, aspirin is given immediately to prevent clot progression. A patient on heparin therapy has bleeding gums and bruising. What should the nurse check? Platelet count, INR, APTT, hemoglobin. The correct answer is option C, APTT. Activated partial thromboplastin time. Monitors heparin therapy, bleeding indicates overdose. A patient with head injury suddenly develops high BP, low heart rate, and irregular breathing. What is this? Shock, hypoglycemia, Cushing trait, renal failure. The correct answer is option C, Cushing traits. Hypertension plus bradycardia plus irregular respiration. The signs of Cushing trait that increases intracranial pressure. A patient with a hypoglycemia becomes unconscious. What is the immediate step? Give orange juice, start IV dextrose, give insulin, take blood glucose. The correct answer is option B, start IV dextrose. Unconscious patient cannot swallow, need to give IV 24% or 50% dextrose. A patient with heart failure asks why they must monitor daily weight. What is the correct response? To check blood pressure changes, to see how much food you are taking, to monitor fluid retention, to check for anemia. The correct answer is option C, to monitor fluid retention. Sudden weight gain indicates fluid overload in heart failure patient. A patient with severe dehydration has dry mucosa, sunken eyes, BP 80 by 40 mm of Hg, heart rate 128 beats per minute. What is the priority? Give oral ORS, start IV normal saline bolus, check urine specific gravity, record body weight. The correct answer is option B, start IV normal saline bolus. Severe dehydration with hypotension, need rapid IV NS bolus is priority to restore circulation. A patient with tuberculosis is placed on airborne precautions. Which PPE is essential? Surgical mask, N95 respirator, face shield only, gloves only. The correct answer is option B, N95 respirator. TB spreads via droplets less than 5 microns. Need N95 mask required. A patient with stroke has right-sided weakness. What is the safest position for feeding? Side lying, supine, high floors, Tendelberg. The correct answer is option C, high fallers. Upright position reduces risk of aspiration. A patient receiving furosemide complains of muscle cramps. What lab value should the nurse check? Sodium, potassium, hemoglobin, calcium. The correct answer is option B, potassium. Furosemide causes hypokalemia leading to cramps and weakness. A patient with a thyroid storm present with fever, tachycardia and sweating. What should the nurse anticipate? Calcium gluconate, beta blockers, heparin, magnesium sulfate. The correct answer is option B, beta blockers. Causes sympathetic overactivity, need beta blockers. Thyroid storm causes sympathetic overactivity, need beta blockers, propranolol to control HR.